I'm Professor Pamela Cairns. I'm Chair of Clinical Paediatric Oncology at the University of Birmingham and Director of the Institute of Cancer and Genomic Sciences and Director of the Cancer Research UK Clinical Trials Unit. The COVID-19 pandemic has really hit all of us very hard. And just because COVID-19 became the top disease that everybody was focusing on, cancer didn't go away and patients were still needing to be treated and we still needed to do the research. The pandemic has affected finances. I think everybody's aware that the fundraising for cancer research has been significantly impacted because of the pandemic, and that is a huge concern. There's many research projects that we'd like to do and we're not at all clear whether they will be funded in the future. So it's a really worrying time for cancer research.
As part of our bowel cancer work, we've grown avatars of cancer. These are small cell models consisting of a couple of hundred cells of cancer which we take from a patient and we use to test new drugs and treatments. The benefits of using cancer avatars for patients are that we can test many new treatments in these avatars rather than test them on the patient, so we can pick the right treatment for the right patient at the right time, and we can also understand why patients become resistant to treatment. Avatars are a very new way to treat bowel cancer, and this is because we use them to precisely target the right treatment to the patient. Before, bowel cancer treatment was a very blunt tool. We would take it out and give a very broad chemotherapy. Now we can use these avatars to target exactly the right treatment for the patient.
Beacon is a trial for children who've got a type of cancer called neuroblastoma. And the types of children that are eligible for the trial are the children who have gone through treatment for the first diagnosis and have either not responded to first-line treatment or the disease has come back later. We're now working on Beacon 2, and Beacon 2, we want to take the best care from Beacon 1, but also look at even more new innovations. We are exploring with the neuroblastoma biologists and the pharmaceutical industry to identify targeted agents that we can bring in to add to the best treatment in Beacon 1 and try and find novel ways to extend the trial in Beacon 2.
One of the things that we've done that we're really excited about is something called the Tessagel Brain Matrix trial. This is a trial funded by the Brain Tumour Charity with additional funding from Innovate UK that is designed to get more people into clinical trials. It consists of a network of 10 centres where patients are treated for brain cancer. That is coupled with a specialised central unit that will deliver the molecular diagnosis that we urgently need to get to patients.
We've used avatars in several other cancers, including pancreatic, esophageal, gastric, brain, breast and womb cancer. And so the techniques we've learnt in bowel cancer can be applied to all these cancers, all of which have their own treatment difficulties.
If you were able to make a donation, please do. Your help will help us deliver an exciting new programme of research, help us get research nurses into our clinics and scientists into our laboratories.
If our research got funded through this appeal, we could employ more research scientists to work on cancer organoids or avatars. We could also buy more pieces of equipment that allow us to quickly profile cancers in the laboratory and transform patient care.
We need to develop new treatments for children with cancer. We need to make sure that every child diagnosed with cancer has the chance of being cured and being cured with less side effects so they go on to do everything in their life that they hope to do.